Radiculopathy, or what's commonly known as sciatica, is pain that you might feel in your legs or even your arms and hands. That actually is coming from your spine, either your neck in the case of your arms and hands or your low back in the case of your buttocks and legs. I get a number of patients who say, my hip is killing me. They have pain that's in the lateral aspect of their hip or in the buttock that goes down their leg and can cause pain, numbness, tingling, sometimes even weakness in the leg. Some people talk about the feeling of a hot knife in their back or in their buttock, in their leg. Some people talk about burning, tingling in the back of the leg or in the side of the leg. And that's something that oftentimes prompts people to come to see me very worried. Generally, we're able to treat this non-operatively though. About 60 to 80% of people are able to be treated non-operatively with a combination of medications, physical therapy, sometimes adjunctive modalities such as acupuncture or massage, and activity modification. So some people ask, well, when would you do surgery? If most people get better, when would you do surgery? That's when people feel like their symptoms are unbearable and they've tried all of the conservative modalities such as physical therapy, ice, heat, massage, activity modification, and medications. If those things aren't working and your symptom state isn't acceptable to you, then I think it's a reasonable time to consider surgical and interventional options. Some of those options are things like epidural steroid injections, both diagnostic and therapeutic, and surgery. And there's a number of different ways to do surgery to relieve radiculopathy. One of my favorite ways to do that, and a way that I'm a huge believer in, is spine endoscopy. That's where we make small dime-sized incisions about 1 centimeter in length, and we use a scope to gain access to and remove any discs or disc material that's pushing on the nerves. We're able to free the nerves up by doing that. And the reason that that's beneficial is because we minimize the envelope of muscle that's damaged, and we're able to minimize the amount of bone and ligamentum flavum that we take. By doing that, we leave the spine in a more stable state after surgery. And so what people describe post-operatively is soreness as opposed to pain. Most people take Tylenol and ibuprofen and take very little in the way of opiate medications for their pain post-operatively. The vast majority of people report complete resolution of their symptoms. Some people have some residual symptoms, but they're much, much more manageable than where they were pre-operatively.